Hello, my name is Jorge Terrazas. I'm going to be the nurse practitioner. I'm going to be observing you today. We're going to be doing a neuro assessment, and we're also going to be doing a musculoskeletal assessment. Is that okay with you?
Yes, sir.
Okay, so to start things off, I'm going to ask you, can you state your name for me?
Aiden Ugarte,
Okay, and what's your date of birth?
11/22/2013.
Perfect. Can you tell me what today's date is?
On December 1st, 2024.
Perfect. Can you tell me who the president is?
Who just won the
No,
election?
the actual president.
Oh, Joe Biden.
Joe Biden. Perfect. Okay. Do you know where we're at right now?
Yeah, we're in El Paso, Texas.
Perfect. Okay. Cool. So, my patient is intact neurologically. He's able to give me today's date of birth, and he's able to state, facts that we're able to go ahead and address and confirm. So I'm going to actually start off with him. I'm going to ask him to take a step, go ahead and stand up. We're going to start off with his balance, and we're also going to start off with making sure that he's walking appropriately, make sure that I don't find any findings for him while he's walking. So what I'm going to do is I'm going to ask you to go ahead and walk towards the camera, okay? So what we're going to do is when we're walking, at first, I want you to stand on your tippy toes, and then we're going to walk on our toes towards the camera, okay? I'm going to be testing for your balance, and I'm going to be making sure that your legs have nice, good strength, okay? So we're going to do that first. You're going to walk towards the camera and then away from the camera. I'm going to be looking at your balance. I'm going to be looking at your legs. And then for the second time, I'm going to go ahead and ask you to go ahead and walk on your heels. So we're going to go ahead and step on our heels, and then we're going to walk towards the camera on our heels, and then we're going to walk back. Okay? Is that okay with you?
Yeah.
All right, perfect. So first we're going to do it on our toes. Go ahead. So the patient is able to keep his balance. We're going to go ahead and walk towards the camera. Go ahead and turn for me. And then you're going to walk back towards me. So there are no abnormal findings. The patient is able to maintain his weight up. He is nice and balanced. Telling me that he's got good, nice, strong legs, good hip flexors and everything. So now we're going to do the same thing, and we're going to walk on our heels. Okay? So go ahead and point your toes up. And then we're going to walk towards the camera. Perfect. Turn and walk back towards me. So patient was able to maintain his toes pointed up, and he was able to walk to and from me. Okay, so now what I'm going to go ahead and do is I'm going to ask you to turn around. We're actually going to look at the patient's symmetry of his shoulders, of his scapula. We're going to make sure that they're even. I'm going to go ahead and lift up his shirt. I'm going to make sure that there's no protrusions, no bruising, no deformities that I can find. Okay, can you go ahead and put your arms back for me? Just stretch them back. There we go. So we got nice scapula movement. We got nice muscles here. No abnormalities found. Okay, perfect. So now what I'm going to ask you to do is I'm going to be looking at your spine. I want to make sure that your spine is straight. I want to make sure that you don't have anything kind of sticking out. So in order to be able to do this, I'm going to ask you to go ahead and reach over and touch your toes, okay? So while the patient is reaching over and touching his toes, I'm going to lift his shirt again. I'm going to look at the spine. I'm going to follow with my fingers, make sure that the spine is nice and aligned. There's no protrusions, and I don't see any. Okay, perfect. So since I'm looking at the patient's, go ahead and stand up now for me. So now, since I'm looking at the patient's spine, I'm going to go ahead and ask him so we could make some spinal movements. So do you think you could reach down to your sides for me, side to side? Do you have any pain, anything like that?
No, sir.
No? How about while I'm going down your spine? Do you have any pain? No? How about when I'm touching right here? No pain?
No.
How about right here? Perfect. You were able to go ahead and go side to side?
Yeah.
Perfect. Now lean forward. And then we're going to lean back. So we're making sure that the patient is able to flex and extend both on his spine. And he's able to do everything. No pain, no abnormalities are seen. So now that we've gone ahead and we assessed the spine, I'm going to go ahead and look at his clavicles. I'm going to feel and I'm going to check his shoulders, make sure there's no abnormalities or no protrusions. While I am assessing his shoulders, I'm going to go ahead and I'm going to test for his mobility, make sure that he's got good mobility of his arms. So what I am going to do is I'm going to ask you to reach forward with your right arm. Perfect. Okay, and you're able to hold it. So he's able to hold it good. Now put it back down, and then you're gonna kind of reach back. Perfect. Do you have any pain when you're doing any of that? Okay, so he's got good mobility of the right shoulder. He's able to reach forward. He's able to extend and flex. Now we're going to go ahead and go back to the center. So now what you're gonna do is I want you to reach out. Perfect. So now we're doing the abduction of the shoulder. Do you have any pain? Making sure I'm not feeling any popping, making sure that we have everything good. There's no deformities. Any pain when I touch here? All the muscle groups are nice and intact. We have the pectoralis right here. Going into the bicep, the deltoid. We have your traps. They're nice and flexed when he's picking up that, when he's abducting the arm. Now, I want you to go ahead and put the hand closer to your body. Pretty close to your body. Perfect. Okay, now we're going to do the same thing on the left side. Once we do a certain activity with one side, we have to do it on the other. So I'm going to go ahead and now with your left side, I'm going to ask you to reach out towards the camera. Perfect. Okay, now I'm going to ask you to reach back. Perfect. Now bring it back down to the center. Now you're going to go ahead and you're going to lift your arm out. Good. So while he's doing that, I am also checking these muscle groups. I feel the deltoid, the pectoralis, and I feel his trapezius. Okay, now you're going to put it close to your body. Now, since I have checked for range of motion, the patient didn't say that he had any type of difficulty doing these ranges of motion. I'm going to go ahead and apply a little pressure. So what I'm going to do is I'm going to ask the patient, while holding both arms, I'm going to ask him to reach forward. And then once he has them forward, I'm going to ask him to reach down. So pretty much what you're going to do for me is you're going to push against my hands, okay? So I want you to push my hands up, 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 up. And I got a nice equal strength. Patient is able to push me backwards, showing me that there's good strength in both arms. Now I want you to pull down, pull, pull, pull. Good, good. So the patient is able to pull me down, which shows me that he has good and bilateral strengths. Strengths to his right and left arms. So now what I'm going to go ahead and do, and I'm going to go behind the patient. I'm going to go ahead and ask him, you're going to lift your arms up against my arms, and then you're going to bring them down, okay? So we're going to start here. Go ahead and lift your arms up. Good. Now lift them up for me. Now bring them down. Good. Patient does have bilateral strengths, equal strength to both right and left arms. Since I am working on the arms, I'm going to go ahead and take this time. We're going to check his deep tendon reflexes. So I'm going to start off with his left arm. I'm going to actually ask him to rest his arm right here on my forearm, and we're going to check for the brachiocephalus. So I'm going to give him a nice tap and check the reflexes right here. Okay. So I do have a little jerking movement of the hands. That's me checking for the brachiocephalic. Now I'm going to check his bicep reflexes, and I'm going to do that by placing my thumb at the bottom of his where his bicep connects, and I'm going to give my thumb a nice little tap. Okay, so I was able to feel a little jerky movement of the arm. Now we're going to check the triceps tendon. So I'm going to ask you to go ahead and turn this way for me. Okay, so, and then I do see that little jerk. Perfect. So now we're going to do it with the other arm. So we're going to do the same thing. I'm going to ask you to bend your arm for me. Perfect. So I'm going to give him a nice little tap. And I did see that little jerky movement right there. Okay, we're going to do the same thing. We're going to try the biceps now. And we did have that little jerky motion on the arm. So now we're going to go around and we're going to do the triceps. And then we had that little jerky movement right there as well. Oh, perfect. Okay, feeling okay? All right, perfect. So now I'm going to go ahead and ask the patient to go ahead and sit down for me. Oh, there we go. Let's scoot this a little forward. There we go. So now I'm going to go ahead and I'm going to start checking for reaction, pupillary reaction. I'm going to ask the patient to go ahead and we're going to be checking for the cranial nerves as well. So I'm going to start out by checking his pupillary reaction, and we're going to check his ocular movements, and we're also going to be checking his eyesight using the Snellen chart. The reaction of the ocular movements is going to test for cranial nerves 3, 4, and 5. I'm also going to be checking cranial nerves 1, which will be the olfactory. We're going to test his sense of smell. So first, I am going to get at the patient's eyesight. I'm going to ask him to look right at my nose. I'm going to be shining a little light into your eyes, okay? And this is just to check for the pupillary constriction once the light hits the pupils. Okay, keep looking right here. Good. Patient's pupils went from about a 5 to a 3, and left pupil is brisk. Go ahead and keep looking at it right here. Good. And same thing. Pupils are round, they're equal. I got 5 to 3, and they are reactive whenever I do shine the light on the patient's pupils. So what I'm going to do is I'm going to go ahead and continue. I am going to ask my patient to go ahead and close his eyes. We're going to check the olfactory cranial nerve. So I'm going to put 2 objects in front of you. I'm going to ask you to take a sniff, and you're going to guess and let me know what the smell is, okay?
Okay.
All right, here we go. Can you tell me what this is?
Coffee.
Yes, perfect. Okay, now I want you to see, well, not see, I want you to smell and tell me what this is, okay?
11.
Perfect. So I did test the olfactory, and I was able to see that the patient is able to differentiate. So in order to check my patient's optic, we're going to use a Snellen chart, and I am going to have the patient go ahead and read it off to me. So pretty much what you're going to do is I don't want you to put too much pressure on your eye. I just want you to put one hand over your eye. Perfect. So we're going to start off with your with your right eye, okay? Can you read this for me?
FPH.
How about this one?
DHGBS.
How about this one right here?
CFDHJ.
And how about this one?
LTFPH.
So I am noting that the patient is 20/20 to the right eye. Now I'm going to go ahead and ask you, go ahead and cover your other eye, and we're going to start a little closer right here. Can you read this one for me?
CLEPTZO.
Perfect. How about right here?
CFDHJ.
And this one right here.
LTFPH.
Perfect. And I was able to see that the patient is able to see 20/20 on both of his eyes as well. Now, I am going to be able to check the patient's trigeminal nerve. I'm going to go ahead and ask him to do a couple of motor things for me, and I'm also going to be able to test it through his sensory. So what I'm going to do is, looking straight at the camera, if I can, I'm going to have you go ahead and I'm going to ask you to show your teeth. Perfect. So the trigeminal nerves, it's actually cut into 3s. We have in the forehead, we have right here in the middle of the face, and then we also have the jawline. Him being able to show me his teeth is part of the trigeminal, and I don't see that there are any abnormalities. His smile is symmetrical. Now frown for me. And he's able to do different things with his facial features, so he is able to go ahead and show me that he is doing okay with his trigeminal nerve. Now I'm going to go ahead and ask the patient to go ahead and taste some things for me. So what I would be doing is I'm going to be testing the patient's facial nerve, and the patient's facial nerve, pretty much what it is on the first 2/3 of the tongue. That's how we get the taste, using that specific cranial nerves. So I want you to go ahead and tell me what you think this tastes like, okay? So go ahead and stick your tongue out for me. Perfect. What taste did that have for you?
Pineapple.
Pineapple, perfect. It is a pineapple drink, so the patient is able to differentiate what the taste is on that for me as well. So we're going to go ahead and test the cranial nerve number 8, which is the acoustic and the sense of balance. So in order to do that, what I'm going to do, excuse me, is I'm going to do what's called a rub test, but I will also be using a 512 hertz tuning fork as well, just so the patient could give us a good idea of how he is able to hear. So I'm going to stand behind you, so if I can have you scoot up. Now, you're going to hear, and I want you to tell me when you hear me actually rubbing your fingers, okay? And then tell me what side when I rub my fingers, okay? So you ready? Okay.
Right,
Okay, perfect.
left.
Perfect. So he was able to go ahead and tell me that he was able to hear when I rub my fingers on both sides. Another way we could perform this test is by actually using a tuning fork. And all we're going to do is we're going to hit our tuning fork, and then we're going to place it right by the patient's ear and ask them if they could hear, okay? So in order to do this, I'm going to go ahead and give it a slap.
Yeah, I can hear that.
Okay, perfect. So again, it's one of those things where you test one side, you have to test the other. So I'm going to go ahead and test his left side now. You want to hear that? Perfect. So he was able to hear those things. So now what I'm going to do is I'm going to have test the cranial nerve number 9. In order to do that, I'm going to be using a little depressor. I'm going to ask the patient to stick out his tongue and say ah. Those are the motor movements that he will be using, and I'll also be testing for his gag reflex. So what we're going to do is I'm going to ask the patient to open his mouth. Okay, so I'm going to shine a light. Give me a second, I'll tell you right now. I'm going to go ahead and shine a light. Now, what I'm looking for is when the patient is actually saying ah, I'm going to be looking for the uvula to be moving. So go ahead and look up. Oh, I'm sorry, not up. Look straight. Stick your tongue out. Open your mouth big, big, big. Go ahead and say ah. So I do see the uvula. It's actually going up once he starts saying ah, and it's nice and in the line. Okay, so now what I'm going to do is I'm going to put this tongue depressor in your mouth, okay? It is going to make you gag a little. It is a little bit uncomfortable, but it is necessary in order for me to test this reflex. Is that okay? Okay, so while I have it, go ahead and stick your tongue out. And that's the patient's gag reflex. I was able to get a positive reflex for the patient. So now what I'm going to do is I'm going to check the cranial nerve number 11. That's the accessory nerve. In order to do that, the motor response for that is going to be ask the patient to go ahead and shrug his shoulders. So what I'm going to do is I want you to sit there, sit up straight, and I want you to bring your shoulders up and down, up and down. Okay, so the patient is demonstrating that he is able to shrug his shoulders. Now I'm going to put a little bit of resistance and make sure that the patient is able to continue with the shrugging of the shoulders and be able to put a nice, good application of pressure just to make sure that it is equal on both sides. Go ahead and shrug your shoulders for me. Perfect. Let them down. One more time. Perfect. And I do have equal strength to both the patient's right and left shoulders when he's able to do that. Now what I'm going to do is I'm going to test the cranial number 12. This one's going to be a little tricky to see on camera. We're not going to be able to see it too much, but I am going to ask him to go ahead and move his tongue against his cheek, and you will be able to see a little bit of a bulge on the outside. So pretty much I want you to look at the camera. So what I want you to do is you're going to push this cheek with your tongue. There you go, just like that. So push against it, push, 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 push. Good. Now we're going to do it to the other side. Push, 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 push. So the patient is able to do that. I will also take this time so that I'll be able to examine the patient's tongue and make sure that it is symmetric and it is in the middle. So go ahead and let me see. All right. Just kind of let it fall out. Don't push it out. There you go. Just let it fall out. And as you can see, the patient's tongue is symmetrical. It's right in the middle of his face, and it's not protruding to one side or the other. So that's telling me that his tongue's muscles, when he's actually protruding his tongue out, they're equal to both sides as well. So what I'm also going to do is I'm going to test for the ulnar nerve. In order to test for the ulnar nerve, I'm going to ask the patient to go ahead and spread his fingers out, and we're going to ask him to hold them out, and I'm going to apply a little bit of pressure while I'm doing that. So go ahead and hold your fingers out as such. Okay, so now that I'm able to do that, I'm going to go ahead and apply a little pressure. He is able to keep his fingers spread apart. There we go. Okay, as hard as you can, hard as you can. There you go. Perfect. Now I'm going to go ahead and I'm going to ask you to go ahead and hold your fingers close together. Keep them close together like this. Perfect. And I'm gonna try to spread them. Don't let me spread them, okay? There we go. Nice and good strength to that. Now I'm gonna check for the median nerve. So pretty much what that's gonna do is I'm gonna ask the patient to hold his hand out. Turn it over for me. Now what I want you to do is I want you to put your thumb, there you go. Hold my fingers and don't let me pull them away. Good. So as you can see, the patient has a good, nice strength right there. Here we go. We're gonna do the same thing on the other side. Give me a good pull. Good. Nice and strong and nice and equal. We're going to go ahead and check the femoral nerves now. And in order to do that, I'm going to ask him to lift his leg against my hand. So in order to do that, just so that I don't block the camera, I'm going to stand to the side. If I can, I'm going to have you put your hands right here. Perfect. So what I'm going to do is I'm going to place my hand right here. And I want you to push my hand up, okay? I'm going to put a little bit of pressure. Okay, you ready? Go. Good. So I am testing the patient's hip flexors, and I'm making sure that he's able to push up against it, some resistance. So now I'm going to ask you to do it the same thing now with your right side. Go ahead and push up. Good. Nice and strong legs. We're able to test. The strength is equal to both hips, and he's able to do both. Now what we're going to do is I'm going to check for his sciatic nerve, and in order to do that, we're going to ask him to pull his heel towards himself. So in order to do that, go ahead and sit back, buddy. What you're going to do is I'm going to pull your foot forward, and I want you to pull it towards you. Good. Nice, strong, and equal. Perfect. Now I'm going to go ahead and do the same thing on the other side. Go ahead and pull. Pull down, down, down. Perfect. Another way that we could test this reflex is to have him actually have his foot up, and then you push, and then kind of like if you were pressing the gas, I want you to push down real hard. Push, 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 push. And as you can see, the patient is able to push my hand down with just his foot. So again, we tested the right side. We're going to go ahead and test the left side. We just got to make sure that it is equal. Go ahead and push, 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 push. Perfect. So we were able to get that taken care of. Now the last thing I'm going to do is I'm going to ask him to do, so I could check the perineal nerve. And in order to test that one, we're going to actually have to ask him to pull his foot up instead of towards himself. So I'm going to put a little bit of resistance towards the ankle. Go ahead and push up. Good. We did the left side. It's nice and strong. We're going to ask him to do the right. And he is able to push both sides up in order for us to go ahead and get everything going. So now what I'm going to do is I'm going to have the patient, we're going to test his coordination. So another way to test it is we're going to have him do some rapid head movements. What I'm going to do is I'm going to, before I do the rapid head movements, is I'm going to go ahead and I'm going to place my hand, and I'm going to ask him to turn against my hand. So go ahead and turn against my hand. Good. And as you can see, the patient was able to completely turn his head towards my hand, meaning that there is good strength in those neck muscles. So now we're going to go ahead and do the same thing. I'm going to stand opposite side for the camera's purposes. I'm going to ask him to go ahead. Good. Perfect. And as you can see, he was able to completely turn his head all the way around. Now I'm going to ask you to go ahead and move your head side to side. Just move it side to side. Perfect. Okay. Now, we are going to do a couple of motor movements as well. That's okay. You can stop now, buddy. Now what he's going to do is I'm going to actually be putting my finger out. And what I'm going to want you to do is I want you with your right hand first, okay? You're going to touch your nose and then my finger, okay? We're going to do coordination, okay? So right here. So if you can, all the way. Go again. 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 Perfect. What I'm testing there is making sure that the patient does have good coordination, which he does with the right hand. We're going to test the left side now. Okay? So we're going to do the same thing. I want you to touch your nose and then touch the tip of my finger. So you're just going to go back and forth 3 or 4 times. Okay? 1, 2, 3, and 4. Patient was able to do them all correctly, and he was able to follow up with that. Now what I'm going to ask the patient to do is go ahead and with the coordination of his feet, pretty much what I'm going to have you do, buddy, is you're going to start with your right foot, you're going to put it on your left, and I want you to just drag it all the way down and then drag it all the way back up, okay? So when I say there, go ahead and start doing that, okay? So you're gonna start up here, now drag it all the way down and then all the way back up. Perfect. We're gonna do the same thing on the other side now. Good. Down and all the way back up. Perfect. So this should conclude my musculoskeletal and my cranial nerve video. Patient had no abnormalities. He had all muscle strengths were equal to both bilaterally upper and lower extremities. Reflexes were all intact and there was no abnormalities. Oh, one more thing. We're gonna go ahead and we're gonna go to try to elicit the cutaneous and superficial stimulation of the abdominal reflex and the plantar response. So in order to do the abdominal reflex, what I'm going to do is I'm going to get something soft, and then we're going to kind of go from the umbilicus, and then we're going to rub the patient, and we should be able to see the umbilicus kind of go into the direction of where we are rubbing. So what I am going to do, buddy, is I'm going to ask you to sit up straight. Okay, I want you to hold your shirt up. So pretty much what we'll be doing is in the abdomen portion, when we strike, and we do see the umbilicus kind of pull over towards. Pretty cool, huh? That it does that. See how it moves? And then we're going to do it again to the other sides as well. Perfect. So the patient's umbilicus was moving into the directions of which I was going ahead and causing that stimulus. Now I'm going to have to tickle your feet. So this is going to be the plantar reflex. Pretty much what we're going to do is we're going to hold the patient's foot up and from the bottom to the top, and we shoot. And we do. And we see those fingers go ahead and kind of come down and pull down. Now I'm going to do it on one side. And I'm going to do it on the other side. So go ahead and keep your feet up for me, buddy. And we're going to start at the bottom and then we're going to go all the way to the top. So there we go. We were able to see the patient and his toes get curled up. All right. Well, this concludes my musculoskeletal and my central nervous system video. Thank you very much. Have a good day. Thank you, buddy.